Everybody, and welcome to Conversations with Dr. Jay Harness. And I'm your host, Jay Harness. And I'm really fortunate today to have a very special guest, Jordan LaBrec, who is a physical therapist, an exercise counselor, and a professor at UCSF, the University of California in San Francisco. He sees patients with cancer-related impairments. He primarily focuses on prostate cancer patients, and he is a pelvic floor therapist with a special interest in wearables to improve biofeedback for pelvic floor training. He teaches an exercise class over Zoom at the Helen Diller Cancer Center and also an in-person exercise class for men with prostate cancer through the UCSF Health and Wellness Program. Jordan, welcome. It's really great to have you here.
Thank you, Jay. I'm so excited to be with you today. Thanks for the opportunity. I appreciate it.
Oh, it's really my privilege. Well, I'm really interested, as you and I have discussed, the vast majority of your colleagues in physical therapy are simply not focused on cancer, are they? They're except for the lymphedema specialists. So I'm interested in your story and how you got interested in cancer patients and obviously particularly prostate cancer patients.
Yeah, absolutely. I think there's been a shift. I definitely think there's more physical therapists who are starting to move into this space, which is amazing. My journey really started when I was doing my master's at Columbia in neuroscience, and I was working as a strength coach for the crew team at Columbia. And then I was also doing research on exercise and addiction and exercise and mental health. And so I really started to develop an interest in taking exercise training and making it more clinical. It was great to be in the performance side of things, but I was seeing how it played out in research and really was interested in how to kind of be in that space and whether or not I wanted to do a PhD or go down the physical therapy route. And it really came down to I really loved working with people one-on-one. And so I decided to pursue physical therapy at Columbia. And during my time as a student there, one of my fellow students started a program called Cancer Fit. And this program was tracking patients' heart rate during sort of a high intensity interval style class with some Zumba movements, some core movements, full body strength movements. So sort of a mix of modalities of exercise. And I saw the way the patients responded to the exercise. I saw how novel it was and how it was really not something that was particularly well known about, but that there was a lot of really good evidence to support it. And the oncologists at Columbia were really excited about the program. I then moved to Boston for a year. My wife was finishing up her medical degree, so moved up to Boston with her and then moved out to San Francisco. And as soon as I got to UCSF, I realized I really wanted to get back into that kind of work. And I met Jane Clark, who was an exercise physiologist at UCSF, who was teaching the Core and More class, which I now teach, and she was doing exercise counseling. And she was getting ready to retire. So she kind of took me under her wing and passed those services on to me. And we now have another physical therapist, Jill Gleason, who's also an exercise counselor and focuses more on the breast cancer side. And as a part of starting those classes, I realized that, we probably needed classes that were more specific to different types of cancers based on where we see the evidence being strong and specific exercise types. And then I started training as a male pelvic floor therapist when I moved out here. They needed someone to work with this big patient load we had. And I was interested and went through some of the training and started seeing a lot of men with prostate cancer and saw the great evidence as exercise as an adjuvant treatment for prostate cancer and really wanted to be a part of that. And that's sort of the genesis of kind of the work that I'm doing now.
Oh, fantastic. And when you got your PhD, what did you focus on when you got your PhD?
So I just did my doctorate in physical therapy, which is the standard now for physical therapy care is a doctorate. My final research project was a project with the crew team looking at injuries for rowers. But a big piece of what I was working on too was that Cancer Fit program. So we didn't do any. I wasn't a part of the research team with that, but that was my focus in my doctorate.
Oh, fantastic. Well, as you and I were discussing before we started recording, I want to look at two sort of different aspects of exercise oncology for prostate cancer patients. First, I'd like you to comment about prehab. As a pelvic floor trainer, you're obviously training patients with prostate cancer who are going to have robotic prostatectomies to be able to control their pelvic floor. But the overall conditioning and the importance of that, Jordan, on their recovering from their surgery.
Absolutely. Yeah. I feel very fortunate that we have a great team here who's been sending me referrals for patients prior to surgery. Our goal would be 6 to 8 weeks prior to surgery. That would be ideal to have enough time to start a program for pelvic floor training. But also, if there's an opportunity to improve fitness, that would at least give us enough time to make someone stronger or to improve their aerobic fitness prior to surgery. We know that BMI and fitness can be having a high BMI can be a risk factor for outcomes like more incontinence or poor sexual function after surgery. So know it's important. And so I've been really fortunate to actually get to see patients before. And that first session really looks like determining their pelvic floor strength. So we use an abdominal ultrasound that can actually
Huh.
take strength measures of their pelvic floor using that. And
Huh.
then we have a
Really?
conversation. Yeah, it's been a really cool tool. It's something I'm
Oh,
actually
and
trying to,
I'm fascinated by that. Really?
yeah.
No kidding. All right.
Yeah, so I'm trying to develop right now more expertise and then start a little research study as it relates to using that as a pre-surgery measure of risk for developing continence. So more to come on that. Uh,
Okay. All right.
but a big piece of that first session too is really laying the groundwork for how important exercise is as a part of survivorship, right? So we start talking about survivorship at that very first session.
Oh, good
And
for
I
you.
lay out the classes and the offerings that we have, right? So if you're in the city, we have this strength in numbers class that I teach, and I have a high intensity interval training class on Tuesdays, and then I have a strength class on Fridays.
Oh,
And
fantastic.
so I lay out the importance of both of those as it relates to the surgery itself, but also if there's more care needed later, right? If you need radiation and hormone therapy later, or if you've started hormone therapy prior to surgery, which some patients do,
Yep.
there's a really big need for things that maintain bone and muscle mass if you're on hormone therapy. So we really lay the stage
Yep.
for what survivorship will look like. And sometimes patients will actually start the class before they go into the surgery, and then they're really well prepared to join back at 8 to 10 weeks.
Oh, that's spectacular. Now tell me about how wearables work. That's one of your areas of interest. I'm
Yeah.
really curious. Are you overall monitoring with wearables? Tell us more about the importance of wearables.
Yeah, we're in the pilot stage of determining how important it is, and I personally, we never like to go into research with too much of a bend, but I think that I could definitely see it being helpful because there's so little information. When we think about doing a video visit for pelvic floor training, you can't see me doing a Kegel, I can't see you doing a Kegel, right? We're going to talk a
Right.
lot about what it is, but there's not a lot of feedback. So one of the things that we're piloting right now is we're doing a study on a bladder wearable that tells people how much urine they're holding in their bladder. That can be a
Oh,
great way to train a sort of bladder refilling and bladder expansion after surgery, right? So if you're leaking a lot, you're going to go to the bathroom a lot to avoid leaking. That can be counterproductive. That can lead to less bladder filling over time, more urgency. So we're doing a pilot study right now on a bladder wearable. And then my goal with this ultrasound study is to look at, can we train someone really well with biofeedback using the ultrasound in clinic? And then can we give them a device to use at home, like an external Kegel monitoring device that helps reinforce that feedback? And does that lead to better outcomes over time? Uh,
okay.
Not really any good trials on those external devices. So we're excited to do a pilot trial and just see what patients think, and then take it a step further and see how it affects their outcomes as well.
Now the bladder wearable,
Mm.
is that an ultrasound-based wearable? What's the technology?
Mm. Mm. It's an ultrasound based wearable. It goes right over the bladder, and it can
Huh.
actually tell you how much filling you're
Yeah,
achieving.
yeah, sure.
Yeah, and it can track leaking. Um, Honestly, one of the best benefits is it really motivates people to keep a bladder diary, which is essential as a part of
Yeah.
rehab to understand what kind of things can be irritants. We train people on what to avoid, but it's kind of helpful to see it right firsthand. So yeah,
Wow.
we're kind of in the process of getting a few of those different projects going, and one that's already going, sort of all building towards looking at our past metrics. Then can we see some improvement with both the implementation of an exercise program that people can follow before and after surgery, and then as a part of their training for their pelvic floor as well.
All right. So down the road, what I want to do is you get going with this project with the bladder wearable. I'd love to do a follow-up conversation with you to have you actually share your screen and show us how it works and whatever.
Oh,
So
absolutely. Yeah,
yeah,
absolutely.
I'm fast. Part of my background is in ultrasound for breast surgeons, and that goes back to the 1990s. And of course, we've known for years that nurses could use ultrasound to see what's going on with patients' bladders, but I had no idea that it had been progressed to a wearable like this. It just, that sounds absolutely fascinating.
It is, yeah. I mean, it's an exciting time to see these things that are, we have this huge ultrasound in clinic, and then we provide people this little
Yeah.
ultrasound for home that can do some pretty incredible things. So yeah, we're really excited about just allowing people to have more objective measures, right? It's
Yeah,
such a
no.
tough time to, be losing urine and not wanting to leave the house. It's so nice to
Yeah,
have some objective measures of progress.
right.
Uh, so I
Well, and it obviously psychologically has got to benefit the patients
yeah.
because they can see the progress that they're making. They can see. I'm just thrilled about this, and absolutely in a few months, as you have more data or more information, let you and I plan a follow-up
Yeah, that
conversation.
sounds great. Yeah, I'd love to
Yeah,
do.
really cool. Well, let's talk about the importance now of exercise in the continuum of care, long-term follow-up for prostate cancer patients. We know from some of the studies done in Canada and elsewhere that when we exercise, myokines are released,
Mhm.
and that myokines have actually been demonstrated up in Canada to have suppressive effects on prostate cancer cell lines when they take the serum from patients that have been exercising, added to the cell cultures, they can actually see a slowing of growth. So I think this is a really important part of the long-term survivorship of prostate cancer patients. And I'm curious to hear your thoughts on that and the kind of programs you recommend that men be involved with.
Yeah, absolutely. And even to draw it to, we were talking about prehab with active surveillance. They've done trials like the RACE trial where they
Yeah.
look at high intensity exercise as a way to decrease PSA
Yep.
velocity and doubling time. So across the continuum, right, we know that there's a really important, it's essential to be, exercising in a way that's most beneficial. And so what we do as a part of this class is we have people come in and do an intake. We measure their VO2 peak. We measure their upper and lower body strength, balance, and mobility, and then kind of create a assessment of where they stand as it relates to other people their age in those different metrics as a way to kind of frame where they should focus when they're home, right? I think one thing I try not to do, there's so much good evidence on exercise with cancer, but we also know that we need to start from a place that's specific for the person. We need to think about what they're already good at and what they could really benefit from being better at. Those things I think are still really relevant. So I try to start the class with really bringing it back to the person. And, you're doing great aerobically, but we see your hand grip strength and your upper body strength on the chest press, and it's lower than other people your age. So this is something that you could really work on strength, right? It helps us
Sure.
really direct the person and where maybe they could really see the most benefit for their specific situation. But then over time, we're tracking a lot of the guys in the class are getting DEXA scans routinely because they're on hormone therapy,
Yep.
and they'll come back and report their bone mass. And as a part of this program, I'm in the next step is really start to collect more data. But the big draw for most of the guys is one really specific strength exercise to improve overall muscle and bone mass, and then two aerobic exercise that is really targeted at improving VO2 peak, and then tracking those things over time to see progress.
Okay. Well, as we wrap it up, Jordan, any other final thoughts you have? This has been an absolutely fascinating conversation with you today. Any final thoughts you want to share with people?
Yeah, I think starting somewhere is really important. It can be I've had a lot of patients say, I go online and I'm looking up all this information. There's so much and it's so complicated to kind of see where to start. And starting with a walking program, going out and walking 30 minutes 5 days a week, and starting with some body weight strength exercises, those things will prepare you for the next step, which is getting into higher intensity exercise or getting into weightlifting. But starting with those baseline things can be much easier and a lot less confusing than sometimes trying to look into the more intense forms of exercise. So I just think getting started anywhere is a really, really important thing. And I hope to provide more resources in the future so it's less confusing for patients.
Oh, fantastic. Well, Jordan, I can't thank you enough for being with us. And as we wrap this up, I want to say to our audience, please join us at cancerfitness.org. We have lots of information there, written blogs, videos. This video will be posted there as well. So as we say, as we wrap up, whatever you do, just keep moving.